I wasn't really the greatest at taking care of my teeth. I never flossed a day in my life. So I reached a point where I had a lot of bone loss, and several teeth were loose. In fact, one tooth I took out by myself. I developed, that I didn't know at the time, periodontal disease. And all of my teeth were getting very loose due to the amount of jawbone loss that I had from neglect and maybe hereditary. It affected the way I smiled or expected the way I could eat. And then, of course, the negative health issues with having the teeth being in such a degrading position. It affected even my interaction with people many times. I would do that. I would try to cover my mouth because that's what you notice. You notice, bad teeth, missing teeth. It was very noticeable, and it affected confidence and affected my quality of life. And eating became very difficult because of my teeth were so loose.
Francis, also known as Butch, one of our favorite patients that's actually came through the practice. When he came into our office, we sat down and devised a treatment plan that could work for him. We took thorough x-rays, we did clinical examinations. We also took a 3D rendering of his facial structure so that when we designed his teeth, we knew that we would have a result that would fit his face. We were able to clean out all the infectious process, the diseased and infected teeth, the gums that had become inflamed, and cleaned all that out, and were able to place the dental implants at the same surgical appointment. Once the implants were placed, we then worked with our laboratory again to be able to align these dental implants with the teeth, with the face, to get an amazing result for the patient.
Going back to the day of the surgery, I was very emotional. I don't know where that came from. I marveled at, first of all, how just expertly, even that temporary set, what a difference that made. And I don't know, I just thought like it's a whole combination of talent and craft and medical expertise and the whole thing. I was so impressed by the attention by so many people. I wanted to express to Dr. McDaniel just how happy I was and how thankful I was, and I can't thank him enough. It was beyond my expectations the teeth would turn out so natural looking, and so I'm extremely pleased with that. Now I don't hesitate to smile or try to cover up. That does a lot for someone psychologically. So quality of life is much better. I would do it again in a heartbeat.